can save worlds in case of crisis. We have Dr.Lipin S Prasad, MBBS, MRCP, FCCS, DH, who is presently working as Casualty Medical Officer at Devamatha Hospital, Koothattukulam. Let's pay heed to him and learn more about different first aids carried out to save lives.
Very good morning, friends. I am Dr. Lipin here. Today I am going to speak about the first aid. First aid was really named by Red Cross, and Red Cross had taken an initiative to celebrate the First Aid Day only to bring awareness among people regarding the importance of first aid, because most of us withdraw our help just because we don't know how to do a first aid. First aid not only means that you apply some bandages or creams onto the wound and then pack them up to the hospital. It is not that manner. First aid means you try to attend a needy person, to be with that person, compassionate be with the patient, and then when the medical team arrives or a medical expertise personnel arrives to you, definitely you are gonna be the help to them. That is why we intend to have a first aid class today. First aid class has been taken in various scenarios and various aspects. The classes have been divided into various specialties also, and hence we divide the programs according to that. You might be heard about advanced cardiac life support, adult life support, basic life support, pediatric basic life support, pediatric advanced cardiac life support, and even geriatric also, so and so. So all this life support programs depends upon giving a first responding care to the needy. As the name suggests, the cardiac life support means you are giving care to the cardiac side and hence sustaining the life. So today I'll be more concentrating towards the CPCR, that is cardiopulmonary cerebral resuscitation. As the name suggests, cardiac, pulmonary, cerebral resuscitation. So you are actually doing a cardiac, that is the heart, pulmonary, the lungs, and the cerebral, the brain. All the three components are being resuscitated or it has been protected while you attend the patient. This is done very simple, that you have to give chest compression. Chest compressions are not simple compressions. They are done very rhythmically, very methodologically, and very disciplined, so that the brain is kept alive even when the heart stops. That is what the concept of cardiac life support means. Brain will be kept alive till a medically equipped person or a person who is expertise in resuscitating a patient beyond our basic life support. So definitely we should know what to do with it. So our topics would be divided into 4 sections. One is discussion about CPCR. Second, we are going to discuss about infectious as well as snake bite. Third is about electric shock, lightning and all those. And then wound dressing, fractures. So why we are concentrating on CPCR is because every patient who arrives to the hospital just bit late arrival might choose their life or death. That's because if the CPCR would have been conducted and if they had maintained till the hospital, many of the patients would have been saved. Might be during an RTA or means road traffic accident, or during assault, or might be a natural cause of death, any kind of cause of death. If it was preventable by a CPCR, definitely it should have been protected. So budding minds like you, definitely I would request you all to know what is CPCR and try to perform it, because we don't know, even in our family also we might require that CPCR in time of emergency. You need not to have medicines, just know how to give cardiac compressions. So during this I'll be showing you the video which I had taken in the hospital so that you will be elaborated how to do a simple cardiopulmonary compression. Once you do that, you have to practice at home so that you learn more and more about cardiopulmonary resuscitation. Conscious level assessment of a patient is important in a resuscitation procedure to know the brain perfusion level. If a patient is conscious, just by saying hello to the patient will definitely let us know that he is responding or not. There are times when we need to shake the person or try to give him a little blow on the chest or over the face to know whether he is conscious or not, because a small amount of syncope can be recovered just by giving a small thump on the chest. Head must be tilted and chin must be lifted as shown in the video. The 3 fingers of both hands rest on the base of the jaw and thumb on both sides of the face. Finally, this is the position what we achieve. This is how a person's face look from above. To know where exactly we need to give the compression, first you have to divide the chest into 2 halves. Then a line bisecting the 2 nipples. When you just take the midpoint where the vertical line dividing the chest into 2 halves and a horizontal line traversing across the nipples meet at a point, and you just have to place the base of the hand over this midpoint and then start giving compression with your elbow straight. As shown in the video, the interlocking of the fingers should be done with the base of the hand placed on this midpoint with the elbow stretched. There should not be any kind of angulations made while doing the compression. A good compression means the chest will rise and depress with the force what you apply. In an adult, you need to apply 2 inch of depth of compression. In a child who is about more than 6 years, you need to apply up to 1.5 inch of compression, and less than 1 inch for baby children who are lesser than 6 years old. But for each compressions, there are different techniques to be done. But here I am trying to give you an example that you need to give a compression over the chest at the midline, at the midpoint, wherever the lines are traversing, and then you have to give the compressions at the rate of 100 to 120 beats per minute. And for every 30 cycle, that is 30 compressions what you give, you have to give 2 breaths through the mouth. Sometimes if the person who is undergoing a resuscitation is not your closest relative, or he is not a friend, or you are reluctant to give mouth-to-mouth breathing, definitely you can skip that procedure and try to give compressions till the ambulance or the medical personnel arrive to your place. Snake bites. Snake bites are very common during rainy seasons, and whenever there is a small drizzle of rain or water being sprinkled around your garden, you tend to see some reptiles around you. Among the reptiles, snake is supposed to be very dangerous, isn't it? Snake is poisonous as well as non-poisonous. How will you know until you get the symptoms of it? Usually the bites of snakes are non-poisonous usually, but most of the part you have to be very careful to how to handle with those cases. If it is a non-poisonous bite, the medical team or the doctor or the person who is expertise in treating the snake venom definitely would know which is poisonous, which is non-poisonous. But you need to do some blood tests as well as clinical examination to come to a complete diagnosis for that. So any snake bite, first and foremost thing is to not to panic during that moment. You should not apply extensive pressure onto the wound, or don't apply a higher pressure tourniquet. Tourniquet is a small thread which you apply across the wound, not on the wound, it is above the wound. Just you are bringing that tourniquet towards the proximal part, the nearer to your body, so that you apply it, so that you don't allow the blood circulating back to the heart will be a poisonous one. So you stop there. Then you have to have an application of bandage if it is possible, and try to splint the limb. Splinting is very important. Why splinting? Splinting is to avoid abnormal movements. I have seen patients with a snake bite elsewhere on the body. They try to move around, trying to show them off. They're saying that they are very bold and strong, even with a snake bite. But you know, if that particular poisonous blood, which is a protein molecule, it gets into the systemic circulation. Even if the patient doesn't die with poison, he can die with some other complication related to something called as allergic reaction to that molecule, or he might die with something else, neurorespiratory arrest. So many things are concerned with any kind of bite. If a bite is unknown, definitely you have to first give compression bandage, apply a tourniquet, not so too tight, and then try to splint that limb. Splint means you try to apply some hard object near to it and try to tie around that particular limb, and then not to mobilize that particular individual, not to mobilize. That is very important. Electric shock is a shock wherein internal and external tissue damage occurs due to flow of the current through it. The current should not pass through our tissue more than a certain voltage. Once it passes more than that particular certain voltage or amperage or whatever energy that it consumes, definitely it will cause burns, that we call it as electrical burns. Once this electrical burns occur, the tissue goes into irreversible damage. It can affect heart, it can affect any tissue through which it is going through. Our nervous system is the one which is more affected during this particular electric shock. So any small shock, like having a shock from a DC battery, small battery, pencil battery, to a household shock, to a live wire shock, like if you are having a high voltage appliances and you are just going and catching on to that particular live wire, definitely you are going to get a shock which will be of a higher intensity, and you will have more damages to it than normal. So you should be very careful with that. Thank you. Thank you for giving me an opportunity to give you a small introduction on first aid. Hope you all have followed my class. So have a great day.
We Marygirites are really thankful to you for detailing various first aids in such a simple and informative way. Thank you, Doc.